So good day everyone. This is your first topic with general pathology, and this is the cellular responses to stress and toxic insults, adaptation, injury, and death. So we know that pathology is the study of the structural, biochemical, and functional changes ng mga cells, tissues, and organs na nagiging rason sa isang ng mga diseases, no, that underlies your diseases. So, what is the difference between your general pathology and your systemic pathology? So, GenPath concerned with the common reactions of your cells and your tissues sa mga injuries, no? So, for example, nagkakaroon ng acute inflammation, no? While your systemic pathology naman examines the alterations and underlying mechanisms in very specific na mga diseases, no? Example, your ischemic heart diseases. Okay? So, the core of pathology, the four aspects of a disease process. So, we have your cause, no, or your etiology, no. Two classes, they can be genetic, no, na inherit nimo siya, no. They can be acquired, nakuha, or it can be multifactorial, no. Padami ang reasons. Next is your pathogenesis. Refers to the sequence, no. The term there would be your sequence, no, pagkasunod-sunod ng pangyayari ng cellular, biochemical, and molecular events that follow the exposures of cells or tissues to an injurious agent. So, na-expose mo na si cell and tissues mo to an injurious agent, no? So, ang pathogenesis, when you say pathogenesis, that refers to the pagkasunod-sunod ng mga pangyayari, may it be cellular, biochemical, and molecular events. Next is your morphologic changes. So, ito lang, yung itsura niya, no, refers to the structural alterations, pagbabago ng itsura niya in cells or tissues that are either characteristic of a diseases or diagnostic of an etiologic process. Okay? So, may mga certain itsura ang may mga certain itsura ang mga cells or tissue, no, pag ganito na disease, no, or pwede ito siya diagnostic of an etiologic process. For example, we can say that this is diagnostic of something. Pag makita ni nato, sure ta na kani siya na sakit. Okay? And next is your functional derangements and clinical manifestation. So, the end result of genetic, biochemical, and structural changes in cells and tissues, no? Pag may mga changes, no, marami ng point na the end results of your genetic, biochemical, and structural changes, no, in cells and tissues, may mo na siyang abnormalities, no? Kani nga mga abnormalities will lead to clinical manifestations, no? Mao na imong ma-feel na sa mga tao na signs and symptoms of diseases as well as its progress. So, when you say progress, no, clinical course niya, unsay nahitabo, ana nga sakita, no? And outcome. Okay? So, again, the end results of any changes, may it be genetic, biochemical, and structural, no, in a biochemical level, sa itsura niya, or ng pamana, no, nga changes, these are functional abnormalities, which kani nga mga abnormalities will lead to signs and symptoms sa mga sakit, no, and its progress. Okay, this is very important. Kani siya na diagram. So, tong board exam na mo sa GenPath, no, kani yun lang yun ang isa sa table nga, sa figure nga akong gina-memorize. So, this is the cellular response to stress and noxious stimuli. So, normal cell, no, performing in its homeostasis state, no, when exposed to stress, no, pag maka-experience ng stress, pwede pa sila mag-adapt, no? Kay kitang mga tao, di ba, how man kayo mo adapt, no? Gihimo ta ni Lord na how mo adapt. So, in the cellular level, no, pag ma-expose to stress in normal cell, no, pwede pa siya mag-adapt, no? Pero pag dili na niya kaya mag-adapt, no? Okay, sobrang sobra na, no? It will lead to cell injury, no? And in another pathway, no, your normal cell in its normal state, in its homeostasis state, no, in its balanced state, pag nagka-injury yan, no, na exposed to injury, of course, will also lead to cell injury. Pag mild lang ang cell injury, no, pwede pa siya ma-reverse, no? Pwede pa ma-reverse, no? Mubalik siya sa iyang pagka-normal cell. Pero pag severe na gyud, no, ang imuhang cell injury, pwede irreversible na ang injury, no? Dili na mabalik ang nakaraan, dili na siya pwede maging normal cell. So, that will lead to cell death, no? Cell death will manifest as either your apoptosis and your necrosis. So, I hope this is very clear, no? This is the stages of the cellular response to stress and injurious stimuli. Okay? So, for example, no, your altered physiologic stimuli, some non-lethal injury stimuli, no, will lead to cellular adaptations. So, kani sila tanan actually i-discuss ni later, no. So, pag naga-increase ang demand, no, pag ikaw na nagda-demand sa imong baligya, di ba, i-increase nimo ang supply. So, mag-hyperplasia lang ka, no, hyperplasia, mag-increase ang production or mudako hypertrophy, no. Pag decrease ang pag dili kay ni halinon na product, no, wala kaayo stimulation, meaning wala nangangailangan ato, no. So mo-atrophy siya, no. So pag chronic irritation, ma-adapt siya. So kani siya, no, kaning upat actually is very important. Pag mahibaw-an ninyo ning upat na terms, no, i-discuss man ni later, dili na mawawala sa gen path, okay? So, ayan. So, reduce oxygen supply, no? Siyempre, pag ang cell nimo, which is kailangan lang oxygen, wala to, no? Or magka-injured chemically, no? Will lead to cell injury. Acute and transient will lead to acute reversible injury, cellular swelling, and fatty change. So, progressive and severe, di ba? Ko, pag severe na gid, sobra-sobra na, it will lead to irreversible injury, will lead to cell death, necrosis, and apoptosis. So, metabolic alterations, genetic or acquired, can lead to intracellular accumulations or calcification, so mga abnormalities. Cumulative sublethal injury over long lifespan, cellular aging. So, ayan, no? Ayan, ito ang normal na cells ng heart mo, no? Pero pag mag-increase ang load niya, pag naakay sakit sa heart, no, mag-increase iyang load, no? So, unsay adaptation sa imong cell mo dako para kayanon nila tong trabaho, no? So, hypertrophy mo dako siya, no? Pero pag ma-injure imong cell, reversibly injured myocyte, no, it can cause cell death, no, pa rin. Let me get back on this later. Okay, so adaptations of cellular growth and differentiation. So adaptation, reversible changes in the size, number, phenotype, metabolic activity, or functions of cells in response to changes in their environment. So in response, no? In response sa mga pagbabago sa environment, bisag kita to mo adapta. So that also applies to your cells, no? They respond to changes in their environment. So first is your hypertrophy. So hypertrophy refers to an increase in the size of cells, no, mudako ang size, that results to an increase in the size in the affected organ. So kinta sa imong heart, mudako ang isa ka cell, no, mudako pud ang imong tibuok heart, and that is dangerous, no. Pero, no, some of it is physiologic and not pathologic. When you say physiologic, no, dili pa siya something na sakit. Normal na siya na adaptation sa imong body, no. So this is caused by increased functional demand, no, or by stimulation by hormones and growth factors. For example, pag na mga newly hormones and growth factors na ma-activate in your puberty, no? So that will cause physiologic hypertrophy, mga anana. So this is the most common stimulus for hypertrophy of muscle is increased workload. So hypertrophy is the result of increased production of cellular protein. So no, that's why people when they work out in the gym, no, modakong gid ang ilang muscles because that is that you stimulate no your muscles na magka-increase ng workload para maglaki ang iyong mga muscle cells. Okay, so ayan. So next, no, this is actually a uterus, no. So later, don't worry kay isa-isahon man nato ang mga sakit, mga most common pathogenesis, no. Next is your karon no, just be concerned no unsa ang hypertrophy, unsa ang hyperplasia, atrophy, no, metaplasia. So next is your hyperplasia. So your hyperplasia, this is defined as an increase in the number of cells. So kung kato size of cells kani number of cells ni daghan in an organ or tissue in response to a stimulus. This can only take place if the tissue contains cells capable of dividing, thus increasing the number of cells. So, kailangan si cell po na siya capability na mo daghan, no? Para po masugdan nga ang iyang response sa changes is mo daghan iyang number of cells. Okay? So, physiologic hyperplasia, no? Physiologic meaning normal lang siya na response sa imong body, no? Dili pa siya something abnormal na makakause og sakit. So this is due to the action of hormones or growth factors that occurs in several circumstances. For example, when there is a need to increase functional capacity of hormone sensitive organs, no? For example, pag manganak ang isang babae, no? So kailangan niya magbigay ng breast milk. So, there is proliferation, pagdaghan sa mga glandular epithelium of the female breast, no, as a response, no, to puberty or during pregnancy, no. Another would be your compensatory hyperplasia, when there is a need for makompensate, no, ang pagmadamage ang liver, di ba? Mo na ilang gingon na okay lang maghatag og liver kay mag-regrow man siya. So, ang nangyari dyan is compensatory hyperplasia. For example, ni resection, no, na gitanggal kay na cancer dito or na aksidente mo, nagka-damage yung liver, natanggalan gamay, no. The liver will actually regenerate. No, that is because of compensatory hyperplasia, no. So hormonal is triggered by hormones, of course. Pathologic hyperplasia, so this is abnormal na. This will lead to EDCs. This is caused by excessive or inappropriate actions of hormones or growth factors acting on target cell. So your endometrial hyperplasia, the balance between estrogen and progesterone is disturbed. So, diba, you know in your anatomy and physiology that there should be a balance between your estrogen and progesterone in a cycle, diba? That's why cycle nga gidugo ta for certain amount of days, no. Kato pag disturb to siya because of so many factors, no, this will magresulta ni siya in an absolute or relative increase in the amount of estrogen, no. And kani pag mudaghan ang imong pag super exposed ka sa estrogen, no, this will cause hyperplasia pagdaghan sa imong endometrial glands, and sakit na siya, no. That will cause abnormal menstrual bleeding, no. So ang uban kay magsige lang bleed, no. So later on we will ayan, diba, this is your normal endometrium, kani kay nagkadaghan ang cells because of exposure to estrogen. So later on, no, we are kani, diba, sa microscope kani normal, kani daghan na kayo siya glands, no, daghan na kayo siya glands. Ayan. So, later on, no, we are going to appreciate, no, the certain diseases. So, introduction pa man eh. Okay, so another would be your benign prostatic hyperplasia. So this is in response to hormonal stimulations by androgens. Although these forms of pathologic hyperplasias are abnormal, the process remains controlled and hyperplasia regresses if hormonal stimulation is eliminated. No? While hyperplasia is distinct from cancer, pathologic hyperplasia constitutes a fertile soil in which cancerous proliferations may eventually rise. So, kani siya, no, actually, benign gani siya. So, dili pa siya cancerous, no? Pero, magod, at some point, nag-ibang patients, mahimo na siyang cancerous. Kay, mura siya gi-fertilize, no? Dito, mo ilang term, this will constitute a fertile soil in which pwede proliferate si cancer. Okay? Next is your pathologic hyperplasia, no? This can also, this is next. Dapat sa pathologic hyperplasia. So, this is a characteristic response to certain viral infections. So, for example, your papillomaviruses, which can cause skin warts, no? Skin warts, and several mucosal lesions composed of masses of hyperplastic epithelium. So, viruses make factors that interfere with host proteins that regulate cell proliferation para madaghan ang cell causing your hyperplasia. So, ayan, di ba? Yan, pag may warts, ganyan ang itsura niya under the microscope. So, mechanisms of hyperplasia. Let me just drink water, guys. Asan naman akong water? Liquid water din. So, mechanisms of your hyperplasia. Hyperplasia is the result of growth factor-driven proliferation pagdaghan sa mga mature cells and in some cases by increased output of new cells from tissue stem cells. Okay, so tissue stem cells, no, sila ang nag-produce og other cells, baka stem cells gani sila, no. So, makakos siya hyperplasia kay nag-output sila, no. And also, it can be a result of growth factor driven proliferation of mature cells na ginagapat-trigger sa ila. Okay, next is your atrophy. So, kung kanina nagadaghan, kanina nag-reduce. Reduction in the size of an organ or tissue due to a decrease in cell size and number. So, physiologic atrophy is common during normal development. So, di ba, anak ko, physiologic is just normal. So, physiologic na paggamay, normal na paggamay sa uban nimong structures is just normal habang nagadakota. For example, no, embryonic structures such as your notochord and thyroglossal duct, mawala na siya at a certain, no, from a baby, pagdakot nimo, mawala lang na siya. Okay? Kani is a good example, no, after, wait lang guys, okay. So, decrease in the size of the uterus that occurs shortly after parturition or pagmanganak ka, no. So, kay dili pa man nimo siya inid na ing ato siya ng size, so manan nimo siya nagamit, so mo decrease pa siya ang size balik, no. So, pathologic atrophy has several causes and can be local or generalized. So, first is decreased workload, atrophy of tissues. So, for example, ako sa una, no, na-dislocate akong tuhod. So, naka-wheelchair at ako for 2 months or 1 month. Bisag, dyan pag ito ng mga klase. Tapos, wala ako nagpa-cast kay musa mo siyang atrophy. So, pero, yun sa ganito. Hindi na ako paisip. Basta, dili siya cast na semento akong tail. Basta mara siya gi-cast na gihapon with microfiber something. So, dili nimo siya ma-move, no? Kaya dapat mag-heal siya. So, tungod kay dili mo siya gina-move imong leg, no? Dili mo siya ginagamit. Dili mo ginagamit ang muscles at ang mga muscles na naa dito. So, dili ko kalakaw ato gina-wheelchair lang ko sa akong mga friends, no? Or pagkatong getting better na, oh my god, nga nang hindi na ako makita ng mga terms sa akong brain. Pero kanang dili siya, di ba? Pag ma-injure ka, dapat dili sa nimo siya i-move. So, wala siya nagagana. So, akong legs kita to guys, kay migamay, nag-atrophy siya because of decreased workload. So, ang uban kay because of na aksidente or for some reason nawala ang innervation sa mga nerves ato na muscle, so dili pud mo galaw ang muscle, so nagkakaroon ng denervation atrophy. Of course, diminished blood supply, no, dili magyapon blood gani nagahatag og oxygen and everything sa imong mga muscle cells. Pag wala blood supply ato, di po nimong gamit, no? That will lead to atrophy. Of course, inadequate nutrition, no? Sa mga bata nga malnourished, no? Nag-atrophy lang muscles. Loss of endocrine stimulation, no? For certain hormones, no? Nag-atrophy pod. And pressure, no? Pag naka-compress for some reason, no? Na naka-compress ato na part or cell tissue, no, mamatay, mag-agamay sila. Okay? Ayan. So, like, that is your brain, no, panagsa pag na-tumor din, ha, no, mag-atrophy siya. Diba? O, diba, kita, napansin nyo, na yung mga certain diseases, ano sa to, na ano sa to? Hala, wait lang, marag ground ang suga. I don't know what's happening. Wala siya. Okay, diba, diri sa left, sa letter A, diba, makita ninyo normal pa siya. Pero diri sa B, nag-atrophy na. Okay, nagamay na. Ngano kung nakaingon gamay, kay nagadako ang space, diba? Nagdako yung space. Okay? So, mechanisms of atrophy. Atrophy results from decreased protein synthesis and increased protein degradation, no? Increase paglabay sa protein o decrease nga pag-produce sa protein. So, the degradation of cellular proteins occurs mainly by the ubiquitin proteasome pathway. So, early in the process, atrophic cells and tissues have diminished function, but cell death is minimal. Saan naman? Weird ba? Sa akong suga. Next is your metaplace. Uy, nag-ground naman eh. Wait lang, guys. Weird. Wait lang, guys. Kaya wala i-pause akong recorder. Ang bot. Okay, tuloy ang laban. Next is your metaplasia. So, ang metaplasia, no, mabalik pa siya. So, this is a reversible change in which one differentiated cell is replaced by another cell type. So, this represents an adaptation response niya sa imong body para mo adapt, no, sa particular na stress. So, kita di ba, pag ma-stress ka, at certain things. So, for example, na-stress ka nagbagsak ka, di ba, mag-adapt ka o mag-study ka more. So, marag ang metaplasia, this is an adaptive response in which cell type is sensitive to a particular stress is replaced by another cell type. So, marag nag-change attitude ka towards studying kay nabagsak ka. So, no? So, marag ang metaplasia represents bother na gid ko sa akong ceiling, guys, na ay something wrong. Represents an adaptive response in which one cell type that is sensitive to a particular stress is replaced by another cell type that is better able to withstand the adverse environment. So, di ba, tungod kayo nag-change ka studying habits, bas ma-withstand nimo ang adverse environment, which is ang mga exams. Okay? So, for example, no, pag si patient is an habitual cigarette smoker, okay? So, normally, ang imuhang esophagus has a, parang baliktad. Oo nga, as a columnar cells, no? Pero maging squamous sila in response to chronic irritation, no, because pero siya chronic irritation because of cigarette smoker, no, and that is bad because that will lead to cancer cells. Okay, ayan, so this one, no, dapat columnar epithelium siya, nagiging squamous metaplasia siya because of chronic irritation to the cigarette smoking. Okay, so metaplasia from squamous to columnar type may also occur as in Barrett esophagus. So, The esophageal squamous, guys, kaya pala parang sabi ko parang baliktad, no? Sa esophagus mo, nagiging squamous to columnar, no? That is your Barrett esophagus. The esophageal squamous epithelium is replaced by intestinal-like columnar cells under the influence of reflux gastric acid. Wait lang guys, parang may something wrong. Hold on. Okay. So, 'di ba? Ganito kasi sa esophagus mo, no, is squamous line sila dapat, no? And your stomach is columnar line, no? So pag natay ginatawag na GERD, no, gastroesophageal reflux disease. So ang acid diri sa imong tiyan mo saka no mo idigab di mo, di ba, magdigab ka, mo na ang isa sa iyang simptomas. So katong acid ni kani si esophagus is not made para ma-stress sila sa acid, no. Dili sila gihimo ni Lord na para maka-withstand sa acid, no. So kani sila mag-adapt. So mahimo silang columnar pod, same sa imong stomach, para ma-withstand nila no, makaya nila tong sigig exposure sa acid, no. So maging columnar lined esophagus na din sila, no. And again, that is bad, no, because that will lead to cancer cells. So ang ubang patient kay paglala na nilang GERD, no, the surgeon itali niya ni, no, iyang pagutan para dili na mag-reflux tong acid dire. Okay? So next is you also have your connective tissue metaplasia, formation of cartilage, bone, or adipose tissue in tissues that normally do not contain these cells. So sakit na ni siya, no. Bone formation in muscle, designated myositis ossificans na sakit, occasionally occurs after occasionally wait lang guys. Occasionally occurs after intramuscular after intramuscular hemorrhage. Ayan. So, diba? Yan. Periphery, mineralized myositis ossificans. So, mechanisms of metaplasia. So, metaplasia does not result from a change in the phenotype of an already differentiated cell type. Instead, nag-reprogram siya, no, of stem cells that are known, nag-reprogram siya ng mismong stem cells that are known to exist in normal tissues or of undifferentiated mesenchymal cells present in connective tissue. So, the influences that predispose to metaplasia, if persistent, can initiate, yan ang sinasabi ko, malignant transformation in the metaplastic epithelium. So, ayan, no. Diba, sabi ko, diba, na-explain ko tong GERD, at saka, yan, yung Barrett esophagus, at saka yung exposed ka sa cigarette smoking. So, again, iulit ko to, in your respiratory tract, no, your respiratory tract is, diba, you know, in your anatomy and physiology, na you have, pseudostratified columnar ciliated epithelium tissue, no. So, pag magsige kag expose si patient to cigarette smoking, no, mahimo siyang squamous epithelia because your stratified squamous epithelium, they secrete more mucin. So katong mucin manggod murag bas mag-counter, mag-form siya protective coat, murag ana para sa sige ka exposure sa cigarette, no. So murag imo siyang pahiran nimo siya og something gelatin ana, no, para dili kayo more siya protective coating, no, gihimo sa imong body para in response sa kairita niya sa smokes, no. So your squamous epithelia is more capable of producing mucin, no, rather than your columnar ciliated epithelium. Okay, so that is the first part of your um, cellular responses to stress. So this will be a quick quiz, no, for yourself, no, para ma ma-review ninyo. Okay, so thank you very much. See you in the next part.